welcome to Amazing Milestones. My name's Tara, and today we tackle a subject of great interest to me. We're going to talk about common feeding problems. I'm expecting my first baby in a couple of months, and when my little one becomes fussy, which of course is going to happen, I would really like to know what to do to soothe his discomfort, and also how do I know if he has colic? It's a very real concern for all mothers, but especially for us first-timers. So I've checked all sorts of prenatal books and blogs on the subject, but I would really like to know a little bit more so when the time comes, I'm ready. In today's segment, we are going to talk about how to identify common feeding problems and what to do about them. And to help me with this really important topic, let's go meet our expert, Dr. Yaremko. Hello, Dr. Yaremko.
Hello.
Thank you for answering my questions today. So firstly, will it be normal for my baby to be fussy or gassy?
So all babies will be fussy in the first 2-3 months of life. So for babies to be fussy for an hour or two per day is very common, and they all go through this experience, and can be a sign of just wanting to be cuddled. So that's a very normal thing.
Okay. And with regards to fussiness and gas, does it make a difference whether I'm breastfeeding or formula feeding, or is it just as common for both?
So fussiness and colic are very common for many of our infants, and it's been shown that whether you're taking breast milk or whether you're taking formula, both groups will have the same amount of fussiness or colic symptoms.
Okay. And what do I do if my baby is fussy or gassy?
So I think the important thing is to make sure that the baby does not need to be fed. Also, you want to make sure that the baby does not need to have his diaper changed. Or finally, maybe the baby just needs to be cuddled. Other things that one can do to help the baby when he's fussy is to carry the baby and gently rock the baby. Sometimes going for a walk with the baby in his stroller, or going for a car ride with the baby in the car seat may be quite soothing. Finally, there's a very small number of infants that might be allergic to cow's milk protein. So for the infants that are breastfeeding, for the mom to change her diet and to exclude cow's milk protein will be quite beneficial for the infant. And for the baby who is on formula, to switch to an extensively hydrolyzed formula may also be beneficial for the child who has an allergy to cow's milk protein.
And you mentioned colic earlier. So what is colic?
So colic is a very common thing, and it's a very benign thing that occurs in about 20% of our infants. To be labeled as having colic, it means that you have these intense fussy periods for more than 3 hours a day.
Okay.
For more than three days a week, and for more than a week. So if you have that kind of intensity of fussiness, then you're labeled colic. We don't understand what the cause of colic is, but we know that it usually presents itself at about 2 or 3 weeks of age. It intensifies at about 6 or 8 weeks of age, and finally it disappears at 3 or 4 months of age with no long-term problems for the infant.
Well, that's reassuring. And what do we do if we suspect our baby has colic?
Again, it's all these behavioral handling things that we can do to help the infant. So taking the child in your arms, and other tricks that we can use in the home is actually having the child close to a vacuum cleaner that's functioning, or close to a water tap that's dripping, and just this soft sound may be quite soothing for the infant. But I think to keep a little diary of the amount of fussiness, and if it seems excessive, to listen to yourself and to talk to your physician to make sure that the child's not having acid reflux with acidity or cow's milk protein allergy remains important.
Right, so follow our intuition.
That's right.
Or get our husband to vacuum for us.
That sounds good, yes.
Okay, well, thank you for sharing your wisdom. It's very comforting to get knowledge from you firsthand like this, so I appreciate it.
Thank you.
Snuggling, rocking, going out for a stroll, all great things to do to soothe your colicky or fussy baby. And of course, if your baby stops crying, it will be very soothing for you too. That's all for today's segment. Next time, we are going to talk about how and when to introduce solid food into your baby's diet. So see you then.